Okay, thank you. Hi, everyone. We're going to go ahead and get started with this session. I want to welcome everyone again to the 2024 Dual Enrollment Conference. And today we're gathered for a session on STEM programming. My name is Brian Hutchins, and I'm going to be serving as the discussant for this session. I'm a senior research specialist at the Early College Research Center at UNC Greensboro. And just a little bit about myself, over the past 10 years, I've been involved in several studies related to dual enrollment, early college, and evaluation of efforts to apply early college principles in traditional high schools. And I've also conducted some of my own research in the area of STEM. I have an interest in non-college bound youth, so I'm kind of interested in what opportunities they have before they kind of immediately go into the workforce. But I want to give the other or the presenters for our session a chance to introduce themselves before we actually get into their presentations. So, Tom, do you mind just introducing yourself, letting everyone know who you are?
Yeah, sure. Thanks, Brian. So my name is Tom Swiderski. I am a postdoctoral researcher with the Education Policy Initiative at Carolina, which is a education research center at UNC Chapel Hill. And I do a lot of research on sort of transitions from high school to college, including obviously dual enrollment in early college high schools, and some thinking about what students are majoring in, and that's what's brought me here to thinking a little bit about STEM.
Thanks, Tom. And Brian, could you introduce yourself to everyone? All right, it looks like we might be still waiting on Brian, but that's okay. What I think we'll do is let me tell you a little bit about what the session is going to look like, and then I'm going to ask Tom to go ahead and give his presentation. And so basically, I'm serving as the discussant. We're going to have two presentations. Tom and Brian are going to present findings from their studies. Then I'm going to give a little bit of a summary and feedback on their presentations, and then we're going to go into a question and answer session. And I want to try to have us leave as much time as we can so we can have a rich discussion. I think there's a lot of interest in this topic, so that's what I'm hoping we'll have some time for really good discussion. So with that, Tom, I'm going to turn it over to you to go ahead and get started.
Sounds great. So let me share my screen here and get that one and view from the beginning. All right, I assume someone will just interrupt me if something is not working, and otherwise I will get us started. So um, so I'll be presenting on uh, research that I conducted originally as part of my dissertation. It's now been published in an academic journal, looking at impacts of early college high schools on bachelor's degree attainment in STEM fields of study using large North Carolina data. And so I want to start with just providing a quick preview of the results as a whole. So what I did overall, is thinking about comparing the degree attainment and the major field of study of early college and non-early college students. So basically the question I'm asking is what percent of students go on to earn a bachelor's degree in a STEM field of study? And how does this differ for early college versus non-early college, similar non-early college students? Overall, what I found is that early colleges increase bachelor's degree attainment broadly. About 30% of early college students eventually earn a bachelor's degree compared to about 25% in a comparison group. And that early colleges also increase STEM degree attainment. So about 12% of early college students will earn a bachelor's degree in STEM compared to about 9.5% in a comparison group. And this is a little bit of a puzzle that the study just has to end on given data limitations, and is a reason I'm really excited to see that there's so many people who are like much closer to the ground level working in dual enrollment programs and in the early colleges who can maybe provide some thoughts and feedback on why I'm seeing what I'm seeing here. But an end result here is that I see that STEM increases are driven only by certain fields of STEM, natural sciences, math, computer science, and psychology, but not engineering or healthcare. And so there's some sort of shifts going on within STEM. I have some theories about why that is, but again, I'll be really excited to interested to hear about what others' thoughts might be. Okay, so now going back and filling in some of the gaps here. So, whoops. So just to make sure we're all on the same page, what are early college high schools, and specifically, what are the early college high schools model that I'm studying? Because I know that early colleges do vary a little bit from place to place and what that means. So in North Carolina, the early colleges are all standalone high schools that students can enter into in ninth grade and stay for a 4, sometimes a 5-year program of study. So students are opting into these schools instead of their traditional high schools, traditional public high schools, for their high school experience. And then, like most early college programs, these are partnered with a local college with the goal that students take up to 2 years of college coursework for free during high school. And so the goal is really that students will graduate, earn their high school diploma, and at the same time have at least, or have about 2 years of college credit, like gen ed transferable credits under their belt, or an associate's degree. These are targeted to students of traditionally underrepresented backgrounds, of students who would be first in their family to go to college, economically disadvantaged, Black, Hispanic, multiracial American Indian students, but not exclusive to these students. And in North Carolina has for a long time had one of, if not the largest early college sectors in the country. This map here is basically highlighting in green any county that has an early college or a very similar model of school in it at present. There's over 100 early colleges or so in the state, and they are geographically spread. They're in urban areas, rural areas, they're all throughout the state. So there's a lot of access to these programs, which is good for both students and the state and for researchers because it gives me a really large and diverse sample to look at. And this is also really good because early colleges have been studied really rigorously and really well by folks at some of my colleagues at Chapel Hill, folks at UNC Greensboro and Rand and American Institutes for Research and others have done really great evaluations of lots of aspects of early colleges. And we see that early colleges are improving high school outcomes and post-secondary outcomes. So in high school, students are taking, as they should, as the model is designed to do, way more college level courses than peers who attend a traditional public school, and are possibly getting at least slightly higher test scores on state or standardized exams, are absent less, suspended less, and they report feeling engaged and challenged and supported by their schools at a higher level or higher rate than peers. Are likely to vote as young adults compared to peers who had not attended an early college. So there's also spillover impacts, not just education, but also sort of pro-social civic behavior impacts. But at the point that I had started this study, we didn't really know much about what majors early college students might be pursuing in college. And I think this could be important for a lot of different reasons, but taking a sort of policy perspective, I think it's important to think about what majors students are pursuing because we know that there is really large variation in students' employment and income prospects according to what they choose to study. And not that that's the only important thing to individuals, but it is sort of a thing that policymakers are going to be thinking about a lot and be interested in. And choosing to focus on STEM for this study is motivated by the fact that STEM fields have been growing, are likely to continue to grow. Some, such as healthcare, we know there are shortages in at least certain areas already. And these STEM fields are generally relatively high wage fields that offer students opportunities for social mobility and living wages. And so the question really becomes, will an early college affect students' major choices through, exposing students to college level coursework earlier with more supports? What students experience, how well they do in courses could all change a little bit. Accumulating credits for free could allow for more, experimentation with different majors. So maybe there are going to be impacts on what students choose to study based on this early college experience. Very briefly, thinking about the data and methods of this study. So I am using individual level data, administrative data from North Carolina, from the Department of Public Instruction, linked up to UNC system data and this National Student Clearinghouse records. This is basically allowing me to look at a large set of students, their sort of characteristics at the time that they entered an early college, their demographics, their prior attendance records and test scores and things like that, and then follow them for at least 10 years from the start of high school to see, did they earn a degree and what field of study did they earn a degree in. So I have a relatively large sample that does allow me to look at something, that like majors, a little over 7,000 early college students, and then up to about 400,000 comparison students. One thing I want to point out is that this is because I'm following students for 10 years from the start of high school, and because it takes a long time to do research and get it through publication processes. These are students who entered high school between 2005-06 and 2008-09 school years. So early colleges may have changed a little or evolved a little since the time frame of this study, but this is to follow students for this long. We have to kind of look at things as they were in the past. And so students are going to be considered treated if they attended an early college in 9th grade. And then I'm going to look at whether they earned a degree and what they earned it in, again, 10 years after the start of high school, which is, normally it would be 4 years of high school and then 6 years after high school. Or for some students in early college programs, they take 5 years of high school and then it's 5 years after high school. As I mentioned at the beginning, early college students don't are not the same, don't have the same characteristics as statewide averages. And so I don't want to just compare early college students to sort of state averages. Here we can see, if we look at these first two columns, early college students are only 40% male, instead of the state is pretty close to 50-50. Racially and ethnically, early college students are actually pretty similar to state averages, but early college students are more likely to be economically disadvantaged, to have a parent, to not have a parent who had earned a bachelor's degree, and are more likely to be found in counties that don't have a four-year campus, often rural counties, which speaks to the fact that these early colleges are really spread throughout the state. And early college students tend to have a little bit higher middle school achievement, just standardized test scores on average than the average student in the state. So it's an interesting mix of students who are maybe socioeconomically disadvantaged in some ways and advantaged or academically advantaged in other ways. I'll be comparing early college students to a set of students that look like them on these and a number of other characteristics listed at the bottom here by creating a comparison group through a propensity score weighting procedure. But key to know is just that I'm going to compare early college students to students who look like them at the point of starting high school. Okay, so in terms of results, I'm going to keep this really high level. There's a lot more, in the full paper, but I can go into those in questions if they come up. But just starting out thinking about what do I find in terms of what percent of students earn a BA or a bachelor's degree of some sort within 10 years of starting high school. Overall, on the left, I find, as I previewed, around 30% of early college students go on to earn a bachelor's degree, compared to about 25% of students in that comparison group. That's about a 5 percentage point increase, and that's very similar to what these prior studies have found, which gives me a lot of confidence that like my sample is representative and that I'm getting good, trustworthy results. And then the rest of the chart here is digging a little deeper, using the large data set that I have to think about what students are majoring in. And so we can see starting with STEM. So, the way to read this would be about 12% of students who start in an early college eventually go on to earn a bachelor's degree in a STEM field of study, compared to about 9.5% of students who of that comparison group not in an early college. And so, this is a pretty big increase, which is good to see. But we can also see when I look at other fields of study, social sciences, liberal arts, and then sort of a catch-all other category, which are things like business or other sort of applied professional fields, they're all increasing. And so one takeaway from this chart might be that bachelor's degree attainment rises overall, and so does sort of every major along with it. There's not necessarily a concentration of increases in STEM or not in STEM. Everything is kind of rising. However, as I mentioned at the beginning, when I dig deeper and focus in on specific STEM fields of study, I do get a slightly different pattern here. So what I see here, starting again on the left, this would say that, students who started in an early college, a little over 4% of them go on to earn a bachelor's degree in a natural sciences field of study. So biology, chemistry, physics, compared to just under 3% of that non-early college group. So from that baseline, that's almost a 50% increase or rate of change, which is pretty large. And we can see that math computer science also increases by quite a lot from its baseline, and same for psychology. But engineering and healthcare in the middle here are not increasing. In fact, it may even be a little bit lower, though it's not a statistically significant difference. So, again, for example, just under 2% of early college students go on to get a bachelor's degree in healthcare, compared to just above 2% of non-early college students. And so what this says to me is that fields like natural sciences, math, computer science, psychology are increasing by a lot more than we would expect if everything was just sort of a proportional increase. And engineering and healthcare are increasing by less. They're not increasing at all. And so it seems like maybe at the margins, some students are maybe shifting a little bit out of engineering and healthcare into these other areas of STEM. And so they're not exiting STEM entirely, but they're switching maybe what specific field of STEM they pursue. Very briefly, I mentioned there's lots of other results. So just to mention a couple of interesting ones, I look at demographic and academic background subgroups. Increases in computer and science and math majors are entirely driven by male students. So male early college students, there's a big increase relative to the comparison. For female early college students, it's about the same rate. And then those decreases in healthcare seem to be driven mostly by female, white, and higher achieving students. And those are students who have higher rates in the comparison group. They're at baseline sort of more likely to be choosing healthcare. So overall, just as a quick summary, I find that early colleges increase bachelor's degree attainment. STEM overall rises with this, but not every field of STEM is rising. Some are rising more than others. Others are not rising at all. And again, I think that that's actually where this sort of has to end due to my data limitations, but I'll be really interested to hear, especially from folks who are closer to the ground. This is sort of my theory of what might be going on, and I'll be interested to hear what sort of resonates. But one thing I've thought about is early college students earn a lot of general education credits in high school. Maybe some of those credits don't always apply to these very specialized curricula that healthcare and engineering programs tend to have. And so maybe for some students who are interested in engineering, but they know they're going to lose some credits if they try to transfer them all to engineering, they say, maybe I'll just choose physics or math or computer science instead. And so, that's sort of my theory of what might be going on. I don't think this is a huge problem, but it's just something I think to be aware of. And to the extent that we want students to be choosing healthcare and engineering as fields that are often, facing shortages and growing quite rapidly, we might want to think about whether the design of early colleges or, increasingly intensive traditional dual enrollment programs might be tweaked to make sure that those programs and pathways are still accessible. But that's all I have. So again, I'm really interested to hear thoughts and feedback, and thank you all for your time.
Thank you so much, Tom. What we're going to do is we're going to switch over now and let Brian do his presentation, and we'll save all of our questions for the end. So if you have any questions specifically for Tom, hold on to those. So Brian, I'll ask you, and we did a little introduction, so if you can give a little introduction of who you are before you get started. Thank you.
Sure. Thanks so much, Brian. Good morning, everyone. I'm Brian Phillips. I'm a senior quantitative analyst at RAND, coming to you this morning from a very rainy Pittsburgh, Pennsylvania. I don't think that the rain explains my technical difficulties earlier. Fairly sure that was user error on my part, but I'm glad to be here now. For background, RAND is a nonprofit, nonpartisan policy research organization with 75 years of experience conducting research on everything from health to national security to education. For the past 5 years, RAND has been a research partner on an ongoing evaluation of North Carolina's dual enrollment program, partnering with the Early College Research Center at UNC Greensboro and the state education agencies in North Carolina. We're grateful for the opportunity to have been a part of that work and this conference. And I'm personally grateful for the opportunity to get down to North Carolina on occasion to meet with folks in person and have some truly excellent barbecue. So on behalf of my co-authors, Julie Edmonds at the Early College Research Center and Christine Mulhern at RAND, I'm pleased to present some of our work looking at STEM CTE dual enrollment pathways. A couple of quick points off the top. This work is funded by the Institute of Education Sciences at the Department of Education, but the views presented here are our own. These are also preliminary findings, not yet peer-reviewed at RAND or a journal. A bit of background on what motivates our analysis. With both dual enrollment and STEM, for a long time, the conversation centered around pathways into jobs that require a 4-year college degree. Dual enrollment is a means for college-bound high school students to take more rigorous courses and start earning college credits, and STEM education to grow our science and engineering workforce and compete in the global economy. CTE, on the other hand, has its roots in vocational education for students, in many cases, thought to be headed straight to the workforce. Now, this dichotomy, as I'm sure many, if not all of you know, has collapsed if it ever existed at all. And there's growing interest in understanding how blending CTE and dual enrollment could give students a jump start. And from federal agencies to researchers, definitions of STEM continue to broaden to encompass occupations and fields that require STEM knowledge, but not necessarily a 4-year degree. So this paper is looking at STEM-focused CTE dual enrollment pathways in North Carolina's dual enrollment program, Career and College Promise, or CCP. And we'll refer to these as applied STEM pathways. Some of you might know RAND's origins are in research for the military, and I picked up some lingo along the way. One is BLUF, bottom line up front. So that's what I'll do here. 3 research questions and the top line answers we found. First, who is participating in applied STEM pathways? We consider 2 sets of pathways, classical STEM fields such as engineering, technologies, and IT, and then health sciences separately. We find that students in classical STEM fields are mostly male with above average exam scores in math and science. Relative to students not participating in dual enrollment at all, they have much lower shares of students who are economically disadvantaged or in racial or ethnic groups that are traditionally underrepresented in higher education. And we include Black, Hispanic, American Indian, and multiracial students in that underrepresented group. On the other hand, health sciences pathway students are overwhelmingly female, though in other dimensions are fairly similar to students not in a dual enrollment pathway at all. Second, what is the impact of participating? We see students picking up an average of about 4.5 CTE college credits in high school versus 0 by construction for the comparison group. And looking across CTE and non-CTE dual enrollment, as well as credits earned through AP exams, CTE dual enrollment students earn about 8 more college credits in high school than the comparison students who would only be earning them through AP. We're seeing large impacts on enrollment in 2-year schools, post-high school, and on associate degree earning, and some evidence of diversion away from 4-year schools, either as measured by initial enrollments or degree completion. Third, how do impacts vary by student characteristics? A couple of key differences are that we see larger impacts on earning short-term post-secondary certificates for the gender overrepresented in the program, meaning larger impacts for males in classical STEM and larger impacts for females in health sciences. We also find that the diversion from 4-year schools seems to be more pronounced for students who are not economically disadvantaged or in underrepresented racial or ethnic groups. For example, students who are not economically disadvantaged earn bachelor's degrees at a lower rate than comparison students, while there's little impact on attainment rates for economically disadvantaged students. To back out for a moment, a bit about the program we're analyzing, which is part of North Carolina's Career and College Promise program. This program was established over a decade ago to consolidate some disparate dual enrollment pathways across the state into structured pathways, and then to codify eligibility criteria for them. 2 of these pathways are not my focus today. One is the college transfer pathway, which is geared towards students aiming to transfer to a 4-year school. And another that you just heard a lot about is the cooperative innovative high school pathway, which includes those early colleges. What I'm going to do is to dial in on the CTE dual enrollment pathway, which is really an umbrella for all sorts of CTE dual enrollment programs of study, from cosmetology to construction to computing. Students are typically, though certainly not always, juniors or seniors when they participate, and they need to meet either a GPA or exam scores requirement or come with a principal recommendation to participate. So we focus on STEM programs of study, which of course raises the question, what do we mean by STEM? And we had a lot of back and forth on this and landed at 2 definitions grounded in groupings of classification of instructional program, or SIP codes. And we analyzed these separately. The first, classical STEM, includes a set of SIP codes that are eligible for a STEM OPT extension visa from Department of Homeland Security. These are areas like information, engineering technologies. And the second includes any programs in health sciences, from nursing and medical assistance to EMT. These programs are often left outside the bounds of STEM, but they enroll large numbers of students. And in conversations with some of our grant partners at the state agencies, there's really a clear interest in understanding the impacts of these programs on students. We identify students as treated if they were in a pathway in 11th or 12th grade at any point, and this could mean taking as little as 1 course. Our sample, our data sources are very similar to what Tom used in his analysis of the early colleges. We're using administrative data from the K-12 public post-secondary institutions in North Carolina. We've also been able to add in National Student Clearinghouse data to have line of sight to students wherever they go, public, private, in or out of state. We're looking at cohorts of 11th graders, and these analyses are analyses. So we're a few years past those analyses Tom was looking at. This would be the first cohort, would be 11th graders in 2012 to 2013. And at this point, our analysis has 8 of those cohorts, ending with those who would have been graduating high school in the 2020-21 period. And then we've got data for 1 year after that from post-secondary, so we can track them 1 year out. We'll be adding one more cohort to our analyses in the coming months before they're totally final. But in what I'm presenting today, we have about 11,000 applied STEM pathways students in classical STEM fields, and about 13,000 health sciences students. And then the comparison group is nearly 600,000 students who didn't participate in CCP at all in high school. Okay. Approach to impact analysis. Again, this is also similar to the methods that Tom used. We used a propensity score weighting approach to compare the pathways participants to non-participants. This is common quasi-experimental approach when we can't randomize some to participate and some not to participate. So we do the best we can. We know who participates. We have their demographics, their exam scores, course taking patterns early in high school. And we also know where they went to school and the characteristics of those schools. So we take a lot of these factors into account and construct a comparison group that looks as much like the treatment group, these observable factors, as we can. And we weight the comparison group such that those who are most statistically similar to the pathway students receive larger weights in the analysis. When we do this, we end up with very tightly balanced groups when accounting for these weights. And we also run doubly robust models that include these same factors that we weight on in our impact estimation. So moving on, in the rest of the slides, I'm going to talk through and put some pictures around the points that I mentioned at the top. This here is showing the characteristics of the pathways participants relative to comparison students. Importantly, these are the unweighted averages for the comparison students. We just want to show descriptively how these students differ from non-pathway students. The variation by gender is most pronounced, with males accounting for nearly 2/3 of classical STEM students and females making up 84% of the health sciences students. The other point to underscore is that other than gender, the light blue bars for health sciences tend to be closer to the beige bars for the non-pathways participants. For example, just 1 in 3 classical STEM students are economically disadvantaged versus 42% for health sciences and then 45% for the comparison group. You see that health sciences in many ways tends to look a little bit more like the comparison group. In terms of impacts on high school outcomes, we see small but statistically significant impacts on high school graduation rates. Here we have the 4.5 CTE college credits on average result that I mentioned earlier. And then in terms of college credits overall, we see classical STEM students earning about 11.5 credits versus 9.8 on average for health pathway students. What this means is that despite being in a CTE pathway, these students are earning more credits that are not CTE college credits, either from taking non-CTE dual enrollment or from AP. And for both sets of pathways, they're earning about 8 credits more than comparison students, who by construction don't earn any credits through dual enrollment, just through AP. When we look at post-secondary enrollments within 1 year of high school graduation, we see large positive impacts on enrollment in 2-year schools for both pathways. And then some evidence, at least for the classical STEM pathway, that pathways participants are a little less likely to enroll in a 4-year institution right out of high school. For post-secondary completions, we see for both pathways, there's about an 8 to 9 percentage point impact on earning a certificate within 3 years of high school. And there's that positive impact on associate degree earning that I mentioned previously as well. When we look at bachelor's degree attainment, we do this within 6 years of leaving high school. So keep in mind that means we have fewer cohorts that have made it that far, and things can look a little different. And here what we're seeing is a small negative impact on completions of bachelor's degrees for the health pathway students. Variation by subgroup is modest, but we do see some differences. For college credits earned in high school, that's not what's right here. We see a little larger impacts for females and students who are not economically disadvantaged and not in underrepresented racial or ethnic groups. On this slide, here's the point I made at the outset about variation in certificate earning. And just to be clear, when we talk about certificates, these are credit-bearing short-term credentials. So this wouldn't include an industry certification. These are things that are tabulated in post-secondary data that come with it. And here we see that the gender that is overrepresented has larger impacts on this outcome. For classical STEM, this means a larger impact for males, about 12 percentage points versus just 5% for females. And then for health, it's the reverse, where we're seeing a 9 percentage point impact for females versus just 4 percentage points for males. And here's to illustrate the variation in how pathways influence engagement with 2- and 4-year schools. First, here's the impacts by economic disadvantage status on earning an associate degree. For both pathways, we see that these impacts are a bit larger for the students who are not economically disadvantaged. And then when we flip over to the impact on bachelor's degrees, we're seeing the small negative impact concentrated among the not economically disadvantaged group. The economically disadvantaged students have lower rates of bachelor's degree attainment overall, but no difference between the treatment and comparison students. We hypothesize that one thing that might be driving this is that participating in the dual enrollment pathways could lead more advantaged groups to consider 2-year schools and associate degrees as a viable path when they might not have otherwise. And then to wrap up, we're finding a mostly good news story, we'd say. Participating in STEM CTE dual enrollment is yielding college credits in high school and results in more students earning a post-secondary credential of some type. Even with that possible diversion away from your schools for some groups, we wouldn't consider that negative if that means that students' post-secondary experiences and credentials align more closely with what they need for their careers. That gets at one of the limitations of the analysis we've presented today, which is that when we think about how STEM CTE could benefit students, the real proof would be years down the line in the impacts on employment and on wages. As part of our planned analyses for the CCP evaluation, we know we'll be able to look at wage impacts for participating in CTE dual enrollment pathway overall. And we're hoping to extend our work to explore variation in those impacts for STEM CTE and maybe even more granularly for different types of programs of study within STEM CTE. For now, I'd say that we're seeing signals that students in these pathways have a leg up heading out of high school and through post-secondary. And we're going to be continuing to extend and pressure test these results moving forward. As I said, we're currently in the process of processing data to add one more most recent cohort to the analysis, and then we'll sort of go from there. So I thank you all so much for your time today and look forward to any discussion or questions that you have.
Thank you so much, Brian. And Tom, again, thank you. I just want to share some really high-level takeaways with everyone. We've got exactly 10 minutes, so I don't want to say much here. I want to leave us more time for discussion, but I want to share a few ideas that I think kind of lead us into the Q&A. And the first is, I think, even though Tom and Brian are looking at really different educational contexts here, um, they're both showing through their research these benefits that students can experience by participating in either the CTE dual enrollment or the early college. So Tom's work highlights that those who participate in early college are more likely to earn a bachelor's degree compared to non-early college participants. And he also shows that 12% of students who attend an early college go on to earn a bachelor's degree in a STEM major compared to 9.5% for comparison students. So some really positive findings there. Brian's work highlights that students who participate in either of the applied STEM CTE pathways earn on average 4.5 CTE credits, and then compared to non-participants, overall they're earning about 8 more credits. So some really positive findings there. Brian also finds that students who participate in applied STEM pathway are more likely to enroll in a 2-year school immediately after high school and are more likely to earn technical credentials or an associate's degree. So I want to follow up on that point a little bit and share some thoughts. I think that's really interesting, and it's showing that students who are in the STEM pathway are going on and completing their education. But this idea that they might be diverting from 4-year programs, I think that's something that we might want to, hopefully maybe we can talk about and unpack a little bit and share thoughts on that. I don't think Brian looked at if the associate's degrees and the bachelor's degrees they got, if those were also in STEM areas. I think that would be something I'd be interested in, that alignment. If they're starting in these STEM CTE pathways and they're continue on in those pathways as they go into post-secondary education. So that's one area. For Tom's presentation, one of the things I think that's really interesting, and he said it himself, is this idea that he's seeing increases across all majors, but in terms of STEM, he's seeing increases in natural science, math and computer science, and psychology, but not seeing those same patterns in engineering or healthcare. And I think Tom's onto something with what's going on when students get to college and maybe how those courses transfer. But one thing I want to add, because I have some of my own personal theories, but this is not a critique of Tom's work. I think we know that early colleges are a supportive environment for students and can really help them be successful. I'm not as convinced we know as much on the advising side and what kind of information they're getting and how they're learning about careers and connecting careers to the courses they're taking. I think that's an area where we need to learn a little bit more and learn, kind of what mechanisms are at play, and maybe talking to those students. Are the things that are going on while they're at the early college, helping them think about majors? Is it really for them once they get to college and they're thinking about the programs, some of those issues getting into these more specialized programs? So I think that's a great area for mixed methods if we could have studies that look at that qualitative side. And what are those conversations like, and what are the students being exposed to in terms of thinking about their futures? And I have my own ideas, but I want to see what others have to say on that topic. And so I know that was a very, very quick summary of those two really great presentations, and there's a lot more that I want to say. But at this point, I want to take the next 7 minutes and open the floor to questions. If you want to come off mute and ask a question, you please feel free to do so. If you want to ask a question in the chat, I'll be monitoring that to help put those forward. But I'm just going to pause and see if anyone wants to start with a question.
Hi, I'm Rebecca. I'm from Minnesota. I have a question for Tom. I saw that you had mentioned a little bit about credits not transferring always to, those specified 4-year college programs. Do you feel like there's kind of an elitism a lot of times from 4-year colleges, and specifically those STEM programs, about taking credits from 2-year colleges or early middle colleges? And do you think they need to be more flexible with what they're accepting, or that early middle colleges need to get their curriculum up to that level?
Yeah, that's a good question. I think that what I was thinking about in making that this sort of theory or hypothesis is that I know that healthcare and engineering don't always have the same gen ed requirements as like a College of Arts and Sciences, because there's just so much specialized curriculum for those programs. And so I know that early college students in the paper, I see that they are earning mostly sort of those gen ed associates, liberal arts associates degrees, gen ed credits that would apply to the arts and sciences college. And so maybe they're not, they've earned more credits there than they actually need to for a healthcare or engineering curriculum, because those just have so many more specialized credits. So that was that was more what I was thinking, is not so much about sort of attitudes or policies, but just that engineering and healthcare are really intensive, really specialized curriculum, and early colleges are not necessarily pushing students into that, but into a more general, widely transferable set of credits.
Thank you, Lisa, for the great question. Others have questions? So it looks like there's a question coming into the chat, wondering regarding Tom's research around students' choice of majors as they pursue an eventual career in healthcare. It's a long process for their students.
Yeah,
Kind of more of a
I'll just say, yeah, Lisa, I think that's a good point. One thing that could be happening is students, say I'm not going to do a nursing bachelor's degree, I'll do biology, but I'll still pursue, a nursing master's, or I'll still pursue medicine later on. That's something I can't see with the current study, but yeah, and that's also part of the reason why I don't want to say like this is a huge problem, because it could also just be, students are still in STEM and they may just be delaying when they're specializing. So, that could be part of it as well.
Hi, I have a question. Do you mind?
Sure, go ahead, please.
Sure. So I'm just thinking about like this specific niche of engineering and healthcare. Because when I think about the teachers at my school, like they're very much pro, like long term, like this will get you a lot of money. This is what we all know is like where we would like to see you. And so those pathways of like engineering and healthcare, I'm just wondering if we're marketing to the right people. So, and I'm wondering if have you done any research with the actual people on the front lines, like the teachers, like the advisors at the school, like the administrators at the districts or at the buildings, because I think that's what drives a lot of what our students do, is like those informal conversations that they have with their teachers. And like what are the pathways that they saw when they were in high school. I mean, I personally had like I started school as an engineering major and realized like my personality wasn't the right fit, and so I switched out. And so that's what when I hear students talk about engineering, or when I go visit different schools, it's really like who they're talking to at the, on that daily basis. So I'm just wondering if you have any research on that regard that might help, or even just the marketing, because I know with healthcare, I'm in New York, and there are a few programs where like students are able to go into this nursing program and they're getting like job offers as soon as they finish the program. And I'm like, that's so, for someone that's mindful of like, they want to start getting paid, they want to do this and not have to worry about so much school. Like there are definitely ways to get to that pathway. It's just, I don't just feel like the people that matter know about it. And just wanted your thoughts on that.
Yeah, I think as you're saying, as Brian was saying, this is sort of the very high level 30,000-foot view, just sort of establishing in the first place, is something happening here? And now that I'm seeing that there is, I think, again, as you're saying, that should motivate digging deeper to talk to people on the ground, school staff, administrators, students themselves, to figure out why is this happening? So yeah, this study is just that high level sort of starting point for thinking about what's happening. And then
Okay,
yeah,
so the awareness is there. All right.
yeah.
Yeah, I wanted to add to that, and I think that this reflects back to a point that we heard in the keynote in the last hour, is that, we know there can be positive impacts to dual enrollment, but who is benefiting from these programs? In the STEM analyses that we looked at, sort of classical STEM, there's a lot of engineering technologies in there, and then health pathways. And so these are, fields where, there's pathways to good jobs and good wages. But we're seeing some disparities in rates of participation in these programs. And so even for health sciences, we say, oh, these students look in some ways similar to students who aren't participating in dual enrollment. But there's still some disparity there in variation. And if we were to look at CTE dual enrollment overall, the demographics of that group looks sort of very similar to the demographics of the state statewide. So if we think about, STEM CTE tends to skew a little bit more towards more advantaged groups, whereas CTE overall looks about like the state overall. What does that mean? What does that mean about the non-STEM CTE participation rates? So like, who is participating in fields of study that are associated with lower paying jobs coming out of school? So thinking about how we get more equitable participation in programs of study that are geared towards good paying jobs, I think is a research question that is for the field and that is still
I think passion. I mean, I think that's what compromises people to sacrifice good pay, right? The passion for what it is that they're going to dive into. So that maybe could be a thread that you can look into.
Thank you, Renee.
Hi, Karen Amaker here from Connecticut State Department of Education. Tom and Brian, your points are well taken. And when you talk about equitable participation, we do have to look at the inequity in who gets in, who has access, not just the opportunity, and then those the level of participation and discrepancies in students of color, women in, say, CNA programs, those kinds of things, which aren't going to lead to high-paying jobs. But what does that trajectory look like for students when they have those on and off ramps? So CNA may be a starting point to nursing, but I think part of this speaks to lack of preparation. Who's involved in the curricular planning? How are the community-based organization supporting educational institutions, and then also making sure that, just as our keynote said, there are a number of different ways in which we can tackle this issue of equitable access and preparation, as well as participation and graduation. So those are, I think, key points to bring to this conversation.
Thank you, Karen. I was going to say, I don't know if Tom or Brian, you want to react to that, but I'm just looking at the clock. We are out of time. The session is supposed to end. So I think unless you have anything pressing you want to share on that, I think we probably need to go ahead and wrap it up so folks can start getting to other sessions, if that makes sense. So I want to thank everyone for being here. It's been a great session. I hope everyone took away something from this session. So I just wish you all the best and hope you enjoy the rest of the conference. Thank you so much.